Hi, good evening. So, welcome back to Wednesday Reading Live. My name is Vandana PS, one of the reading trainers from Nedu's Academy. So, as I already promised in the previous live, I'll be showing part B questions exclusively in this live. Okay, so are you guys ready to test your accuracy or speed in part B of OET reading? അപ്പോൾ എത്ര പേര് റെഡിയാണ്? ഞാൻ ഡയറക്റ്റ് ആയിട്ട് ക്വസ്റ്റ്യൻസ് ഓരോന്നായിട്ട് സ്ക്രീനിൽ കാണിക്കുന്നതായിരിക്കും. I'll show all the questions in part B one by one on the screen. So that what you can do is, you guys can read the question, you can read the options, you can read the paragraph, then you can apply elimination method, then find out the right answer. Okay, so likewise, usually നമ്മൾ ഒരു ക്വസ്റ്റ്യൻ ആയിരുന്നു കാണിച്ചുകൊണ്ടിരുന്നത്, but still today I'm going to deal with the complete material of part B of OET reading. So I'll give you 2 minutes for each question, then I'll show you the answer case of each material. Okay, then അത് കഴിഞ്ഞിട്ട് നമുക്ക് ആൻസേഴ്സ് ഡിസ്കസ് ചെയ്യാം. So before moving to the material, let me know how many students have joined this live. എത്ര പേര് join ചെയ്തിട്ടുണ്ട്? Yes, good evening. Okay, so ready or no? Shall we do the material? Okay, so here comes the first material. Okay, I think you can see the material on the screen. So what you have to do is just read the question and underline the keywords. And it is not possible, I know you can't underline the keywords because it is a live, but still you can just understand which are the keywords from the question. Then you can read options one by one, understand which is the category of the question they're asking in part B of OET reading. Then read the paragraph, find out the right answer through elimination method. Okay, hi Alfonso, good evening. Yeah, so this is the first question. Okay, so welcome back. So have you all done the material? So that is first question. I hope you have done the material. I mean the first question of OET part B. I'll read the material, I'll read the question, then we will discuss the right answer. Okay, hi Ria, hi Janie, Atira, hi Geeta, good evening. So, the question is like the purpose of this guideline on the use of anesthetic gas is to. Okay, so the keywords from the question which I can say, which are anesthetic, then gas. Okay, and option A. So this is a guideline, that means this is from the first category. Guideline alle. So guideline either category ana. So guideline which means the first category. And option A, emphasize the importance of patient safety during its administration. So by keywords emphasize, then importance, administration. And option B, identify those patients who are most at risk after it has been used during a procedure. So the keywords are identify, then risk, and procedure. And option C, clarify the criteria for deciding whether patients who have received it can perform certain tasks. So clarify criteria and certain task or perform. Okay, so I'm underlining task here. So now tell me, what is your answer? Yes, എത്ര പേർക്ക് ആൻസർ കിട്ടി? Whether it is answer option A, B or C. What is the right answer? And within that time, I'll just read the paragraph as well. Safe use of Entonox gas for short-term pain relief or anesthetic gas. Patient information. All patients receiving Entonox must be given verbal and written information via patient information leaflet LN1215 available for the hospital intranet regarding the drug. So it should be informed, that's it. When Entonox is used as a sole analgesic or sedative agent, driving and use of complex machinery is not recommended until, it is not recommended until at least 30 minutes has elapsed after the administration Entonox has ceased. Ceased which means it is coming to an end. Then next one, the healthcare professional has assessed that the patient has returned to normal mental status that is oriented to time and place. And the last one, the patient feels that they are competent to drive or use machinery after the relevant procedure is completed. That is, there is no residual drowsiness or lightheadedness. Additional care is needed when Entonox is administered to a patient who has been given associated medication. So that is all about the Entonox gas administration mentioned here. Now tell me, what is your answer? In the answer kitte, can you please comment here? Hi Vincent, yes Suma, hi Felba, good evening. Yes, please do comment your answers here. What is your right answer? Is it whether it is option A, B or option C? Okay, ഏതാണ് correct answer? Option A ആണോ, B ആണോ, C ആണോ? Hi Selvi, good evening. Yeah, so what is it? A very simple question, I would say, but this is just an exam model question. Okay, so I'll give you the answer today. Answer is option C, clarify the criteria for deciding whether patients who have received it can perform certain tasks. Okay, and option A, emphasize the importance of patient safety during its administration. Where is it mentioned in the para? This is all about emphasizing the patient safety. So that I can say not mentioned. And what about option B? Identify those patients who are most at risk after it has been used during the procedure. So identify those patients who are most at risk. Where is it mentioned again? People who are under this much risk, most risk patients, again not mentioned in the paragraph. So simply answer is option C. Criteria evidana parayunnathu. So these are the 3 criteria they have mentioned. Okay, so that is the right answer. Hi Javita, good evening. Okay, so that's all about the first question. Now I'm just jumping to the second extract, second question. Again, you can read the material, then we will discuss the answer. Okay, so here, again I'll give you 2 minutes for the same question. You can just take your time and find out the right answer. So here comes the question. Okay, so that's it. Okay, so yes, Atira, first question, which is from the first category. First sentence is important, reading for the details. Very good, dear. Yes. And what about the second extract? So, second question is from policy, and the extract from policy on. Okay, Atira, answer is option C, A, B, not mentioned. Okay, dear, that is right. First question. Yes, Rajesh, option C was the right answer. Now, second question. Yes, have you done the material? Second question. Second question. Okay, the extract from the policy on adult patients who go missing emphasizes the importance of. So, this policy is all about adult patients who go missing. Miss-ആവാൻ chance ഉള്ള പേഷ്യൻസിനെ പറ്റിയിട്ടുള്ള adult പേഷ്യൻസിനെ പറ്റിയിട്ടുള്ള ഒരു പോളിസിയാണ്. And this policy emphasizes the importance of dash. So, this is an incomplete question. So, policy എന്ന് പറയുമ്പോൾ ഏത് കാറ്റഗറിയാണ്? Policy, which means that comes under the second category, and the first 3 sentences are important, or first paragraph is important, and we are reading for the main idea. So, option A, establishing the likelihood of this as soon as possible. So, the keywords establishing, then likelihood, as soon as. And option B, enabling staff to visually identify patients at most risk of this. So, keywords enabling, visually, and most risk. Option C, working with relatives in order to locate patients who have done this. So, relatives, locate, and done this. Okay, done. So, these are the options from these three. These are the keywords from these 3 options. Now, I'm going to read the passage. Hi, Aksa. Good evening. Did you do the material, Aksa? Now, so the material, the extract, adult missing patient policy. An assessment on admission may determine whether the patient has confusion, memory problems, depression, and or is at risk to themselves. These are all indicators of an increased risk of them going missing from the hospital. See, first 3 sentences then answer on I can say. Because എന്താണ് patient admission സമയത്ത് തന്നെ we are assessing the patient. How we are assessing the patient? എന്തൊക്കെ കണ്ടുപിടിക്കുന്നുണ്ട്? We are determining that whether the patient has confusion ഉണ്ടോ, and the memory problems are there, depression or risk to themselves. They are all indicators, or they are all symptoms of increased risk of them, which maybe they can miss from the hospital. This assessment should include any previous history or patterns going missing, and should be completed in collaboration with the patient or with input from family or a designated contact. So, these kind of assessment should be done within patient's consent, patient plus maybe with the family members or with designated contact. Patients whose mental health status may change rapidly spontaneously, fastly, due to their medical condition may require repeated risk assessments over the day. Medical and nursing staff must undertake this jointly, and the outcome must be recorded in patient's clinical record. In clinical areas, all inpatients must wear a wristband that includes forename, surname, date of birth, ID number, and gender. For patients identified as high risk, it is good practice to ensure that their wristbands also include details of their current care location. Okay, so that's all about the missing patient cases. So, what is the right answer here? Answer. Is it option A, establishing, confirming, determining the likelihood of this as soon as possible? Okay, establishing the meaning in the finding out, confirming, determining. So, that is establishing. Likelihood of this as soon as possible, which means how probable or likely this. Okay, then as soon as possible, which means without any delay. And what about option B? Enabling staff to visually identify patients at most risk of this. Enabling staff to, that we are just identifying staff, we are just enabling staff. Enable cheya, which means we are using the staff, we are helping the staff to visually identify. Visual identification is mentioned there through wristband. Patients at most risk of this. Only visual identification is mentioned, that means wristband. Other than that, we are helping the staff visually identify patients at most risk of this. I can say it is not mentioned in the paragraph. Option C, work with relatives in order to locate patients. Patients are located. If you want to locate the patient, where is it mentioned? You have to work with the relatives. Again, it is not mentioned there. So, simply the policy is all about what is the main idea. They are confirming, they are establishing, they are identifying the likelihood of this as soon as possible. ഇങ്ങനത്തെ പേഷ്യൻസ് ഉണ്ടോ, whether the patient, what are the type of patients they can do like this. So likewise we are identifying or establishing the likelihood of patients. Okay, so answer is option A. Yes. Hi Bensi, good evening. Yes Athira, second one is policy, second category. Very good dear. Okay, so now I'm just moving to the third question. Okay, and the third question, this is a very short paragraph and it's all about an email or email aanu thanirikkunnathu. So that means third category, and yeah, I'll give you 2 minutes for the same question. You guys can just read the question, then we will discuss the answers. So here comes the question. All right, so the time is over. Yeah, have you done the question? So into the third question, the email about just in case boxes includes information on. So directly mentioned, this is from the third category. This is an email, and what are you reading for in an email? We are reading for the purpose, which means the overall idea. And this is the third category, and the last lines are important, or I can say the last paragraph is important. And option A, the rationale for providing them. Rationale in the reasons. Okay, reasons. And option B, a change in policy regarding them. So change policy which means a rule or a regulation, an act. Option C, some concerns raised about them. So concerns which means some worries or problems raised about them. And the material, 2, staff working off-site from hospital board, subject just in case boxes. Like many areas nationally, we are now developing a system of just in case boxes to support anticipatory prescribing and access to palliative care medication for patients with common symptoms in the end of life phase, example pain, agitation, breathlessness and nausea. Adequate quantities of appropriate medicines will be prescribed for the patient and stored in identifiable container, the just in case box, in patient's home. Carers and patients need to be reassured that the prescribed medicines have been prescribed just in case and may not be needed. Patients and carers will be provided with the contact phone number to ensure timely access to symptom assessment and management. So it's a very simple para. Okay, so now what is the right answer? Is it option A, B or C? Okay, Afzana. Atira, yes, reason. Rational which means reason. Very good dear. Yes, Jenny. Answer is option A. Divya, option A. Okay, so I'm just going with you guys. Answer is option A. the rationale for providing them. That means what are the reasons why we are providing just in case box to the patient. So that is the right answer. That is the overall idea. That is the purpose of the notice. Option B, change in policy. Any act mentioned here, any rule mentioned here, not mentioned. Some concerns raised about them. Concerns, which means again problems or worries, tensions. Anything mentioned about some concerns? Again, not mentioned. So answer is option A. Yes, Aksa, very good. Okay, so that's all about third question. Now, fourth question. Okay, so fourth question is actually, it's a bit distracted, but I'll give you time for reading the question and options, then I'll show you the material. Okay, so here comes the question. Okay, so the time is over. Now, fourth question. The guideline on summoning clinical assistance stresses the importance of. So here, summoning, which means, so this is a guideline again mentioned directly in the question. This is from the first category. And summoning, which means requesting, okay, requesting all or call for. So that is requesting, urgently requesting. So that is requesting. Clinical assistance stresses the importance of dash. Contacting the medical staff currently treating the patient. So contacting staff, then currently. And option B, following a set procedure in order to obtain assistance. So following procedure assistance. Providing immediate first aid until help arrives. So immediate first aid until. So these are the keywords. Yeah, ask for alla, summoning, which means requesting for aanu kata. Yeah, request. Hi Murli, good evening. So now the paragraph, summoning clinical assistance. If someone is found collapsed, not breathing normally, or requires urgent medical assistance, dial 2222 straight away and ask for the cardiac arrest team. This may involve leaving the patient or the person alone. Inform the switchboard whether the person is an adult or a child. On return to the person, commence emergency life support if required. See? Life support വേണം അല്ലെങ്കിൽ you can provide with some first aid or something. പക്ഷേ എപ്പോഴാണ് if it requires, patient അത് ആവശ്യമുണ്ടെങ്കിൽ you can provide that. So that from that particular option, line, you can eliminate option C, providing immediate first aid until help arrives. Help വരുന്നത് വരെ first aid കൊടുത്തോണ്ടിരിക്കണം എന്ന് പറഞ്ഞിട്ടില്ല. So that you can eliminate option C. The cardiac arrest team leader will be responsible for further assessment of the patient in liaison with other relevant specialities. So liaison എന്ന് പറഞ്ഞാൽ communicator എന്നുള്ള meaning ആണ്. So this team leader is working with the patient as well as with the relevant specialities and decide on the most appropriate area to transfer the patient for further assessment or care. If emergency department advice is even then required, call the ED on 6699. If the ambulance service is required, provide ambulance control staff with clear and concise clinical information as requested, along with the directions to the site of the incident. Avoid using abbreviations. Okay, so that's all about that one. Now tell me, what is the right answer of this question? Idinte answer ഏതായിരിക്കും? Is it option A, contacting the medical staff currently treating the patient? ആണോ? ഇപ്പം പേഷ്യൻറ്റിനെ ട്രീറ്റ് ചെയ്തുകൊണ്ടിരിക്കുന്ന പേഷ്യൻറ്റിനെ കോൺടാക്ട് ചെയ്യുന്നു എന്നാണോ മെൻഷൻ ചെയ്തേക്കുന്നത്? I can say it's not mentioned here. Anywhere mentioned there? You can contact the medical staff currently treating the patient. Where is it mentioned in the para? ഇപ്പോൾ പേഷ്യൻറ്റിനെ ട്രീറ്റ് ചെയ്തുകൊണ്ടിരിക്കുന്ന ആളെ വിളിക്കാന്ന് എവിടെ പറഞ്ഞിരിക്കുന്നത്? Majority you guys are saying option A, right? Okay, so this question, ഈ ക്വസ്റ്റ്യൻ്റെ ആൻസർ ആണോ? Anyway, I'm so sorry guys. Answer is actually option B, following a set of procedure in order to obtain assistance. Assistance കിട്ടാൻ വേണ്ടി ചെയ്യുന്ന പ്രൊസീജിയേഴ്സിൻ്റെ ഒരു സ്റ്റെപ്പ് ബൈ സ്റ്റെപ്പ് ഗൈഡൻസ് ആണ് കൊടുത്തിരിക്കുന്നത്. That is the guideline is all about, right? Yeah, so answer is option B. Okay, so now I'm moving to the fifth question. And the fifth question, it's all about the purpose of the extract from a policy. Again, policy extract ആണ്. And it's all about seasonal influenza management. So you can read the question, find out the answer. Okay, so time is over. The purpose of the extract from policy on seasonal influenza management is to. So already I mentioned it is a policy from second category. It's all about the management of seasonal influenza. To explain the procedure for establishing isolation facilities, explain procedure and establishing. Identify the staff responsible for moving patients into isolation. Identify staff and moving. Option C, outline the procedures for the care of patients in isolation. Outline procedures, isolation. So these are the keywords from the options. And the paragraph, seasonal influenza management policy, isolation. Patients with suspected flu will be admitted to a single room. Suspected ആയിട്ടുള്ളവരെ എങ്ങോട്ട് അഡ്മിറ്റ് ചെയ്യുന്നത്? സിംഗിൾ റൂമിലേക്ക്. Patients with confirmed flu will remain isolated in a single room by or cohort bay. Cohort bay, which means still they are isolated for the duration of their infectious period or until discharged. If a patient requires ventilatory support, a negative pressure room in the ICU should be used. Ventilatory support വേണമെങ്കിൽ they can be used that. In such cases, a discussion between a respiratory physician and site management must happen. If it becomes necessary, sufficient single rooms or cohort areas will be designated for patients with confirmed and suspected flu by the hospital management. Isolation patients undergo investigations in other departments provided the relevant department has received advance notification. While outside isolation, the patient should wear a surgical face mask. The area and any equipment that the patient has been in contact with should be appropriately decontaminated on completion of the investigation. So, again, coming back to options. Option A, this is all about explaining the procedure for establishing, identifying isolation facilities. Isolation facilities identification ആണോ ഇത്? Is it a procedure dealing with the identification of isolation facility? It's not at all. Option B, identify the staff responsible for moving patients into isolation. Again, where is it mentioned this staff is able to move the patient into isolation department or room? Not mentioned here. So that simply answer is option C. This is all about an outline regarding the procedure for care for patients in isolations. Very good, Shini. That is the right answer. Okay, so we are coming to the last question from part B of OET reading. Question number 6. Okay, so now you can just read the question and find out the right answer. Alright, so into the final question from part B of OET reading. The extract from a pulse oximeter manual includes a reminder that the device. So this is from manual aanu. Manual nu thannittillenkilum you can understand that because it is all about the device pulse oximeter. Option A, the device may stop working without warning in some circumstances. Option B, may still be used when it is internal power supply is unavailable. And option C, may be irreparably damaged if it is left to recharge for too long. So these are my keywords from the options. And into this material, pulse oximeter manual recharging the battery. When new and charged to full capacity, the oximeter's internal battery provides at least 5% hours of continuous operation at normal temperatures. A low battery message appears when 5 to 15 minutes of battery operation remain. When the alarm message connect a unit to line power appears during operation on battery power, an audible alarm sounds and the oximeter automatically shuts off in approximately 10 seconds. So from those sentences, I think we can simply eliminate option. Option A, without warning or no, with warning, see, with loud alarms. So contradictory or opposite option. Important. To prevent permanent loss of capacity, recharge a discharged battery within 8 hours after the low battery message is displayed. To recharge, plug the oximeter into the AC power supply and note that the oximeter remains operational while recharging the battery. The battery will not overcharge. Will not overcharge, which means it will not overcharge. Battery stored for extended periods of time should be recharged every 6 months to remain their charging capacity. Okay, so what is the right answer here? Remaining two options are there. Option B, may still be used when its internal power supply is unavailable. Internal power supply illengilum ningalku use cheyam. Sheriyalle? Yes. And what about option C? May be irreparably damaged if it is left to recharge for too long. Where is it mentioned? If you're recharging the battery for a long period of time, it will be irreparably damaged. Not mentioned in the paragraph. Simply answer is option B. That is the right answer. Okay, so that's all about today's material. Okay, so anyone with 6 out of 6, so please do comment your marks in the comment section so that I can identify how many students got the complete marks in part B of OET reading. Okay, so please don't miss the session. Please do watch the session completely. It will be very helpful for you because every questions are exam model questions, and I hope you guys will watch the session until the end. Okay, so thank you. Take care. Bye.